There's so much information out there on vitamin D3, but what about its counterpart? What is vitamin K2? What does it do? How much should you take? Let's discuss this and more in today's video. Hi everyone, I'm a doctor. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. This video series was created to help answer some of your medical questions and the questions that are commonly asked by patients. If you find this video helpful, please subscribe. So first off, let's talk about what vitamin K2 is. Vitamin K2 is a fat-soluble vitamin, and it's important for blood clotting. It has been known to be involved in over 400 different chemical reactions. Some of these include amino acid and protein metabolism, bone metabolism, and prevention of arterial calcification. Vitamin K2 also has a role in energy production, wound healing, and preventing excessive bleeding after surgery. Vitamin K2 is produced by our friendly bacteria that reside in our gut. That's right. Now, one thing that's important to know about vitamin K2 is that it is highly dependent on an adequate intake of other nutrients. This includes vitamins A, D, and E, as well as the minerals zinc, calcium, and magnesium. Now, this is particularly important for our older population because they tend to absorb less of these nutrients. Also, vitamin K2 absorption decreases with age, so the older we get, the less vitamin K2 we tend to absorb. Additionally, certain medications such as PPIs or antacids can decrease the absorption of vitamin K2. The recommended daily allowance of vitamin K2 is 90 micrograms per day for men and 80 micrograms per day for women. It's important to note here that the upper limit of what is considered safe for vitamin K2 is very high at 11,000 micrograms per day. Now, obviously, most people are not going to be taking anywhere near this amount, and actually, most people are probably not getting anywhere near the recommended daily amounts. Now, why is vitamin K2 important? Well, it's really important in preventing something called calcification of our arteries. Calcification of our arteries is where calcium builds up in our arteries, making them stiff and rigid, and increasing someone's risk of having a heart attack or a stroke. Arteries that are calcified are also more prone to rupturing, and this can lead to things such as an aneurysm. Vitamin K2 helps keep calcium out of our arteries and in our bones where it belongs. Vitamin K2 also helps prevent atrial fibrillation, which is a problem with the rhythm of our heart. It also helps prevent excessive scar tissue formation after a heart attack. And it aids in the production of several proteins that help regulate blood clotting. This brings us to the question, how do you know if you're deficient in vitamin K2? Well, some of the signs and symptoms can include excessive bruising, heavy menstrual cycles, spontaneous nosebleeds, and excessive bleeding after a surgical procedure. As I previously mentioned, vitamin K2 is needed for proper blood clotting. So if someone is deficient in vitamin K2, they will have a hard time forming blood clots when they need to, such as when they get cut or injured. However, vitamin K2 deficiency is relatively rare. So who is at risk for becoming deficient in vitamin K2? So what happens if someone is deficient in vitamin K2? Well, as I mentioned earlier, one of the major concerns is calcification of our arteries. This can lead to an increased risk of developing coronary artery disease, peripheral vascular disease, and cerebrovascular disease. Vitamin K2 deficiency can also increase someone's risk of developing atrial fibrillation and heart failure. So how do you treat a vitamin K2 deficiency? Well, the obvious answer would be to increase your intake of vitamin K2 either through diet or supplements. But it's important to realize that treating a vitamin K2 deficiency may require treatment of the underlying cause. For example, if someone is on antibiotics, then they may need to stop those antibiotics or switch to a different class of antibiotics that doesn't affect the normal gut flora as much. If someone has liver disease, then they need to address the liver disease. And if someone has intestinal issues, then they need to address those issues. When taking supplements, there are several different forms of vitamin K2. The most common form is MK7. There are also other forms such as MK4, but there are not a lot of studies comparing the different types of vitamin K2, making it difficult to say which form is best. One thing that's important to know about vitamin K2 is that it is fat-soluble, and this means that it can build up in our bodies. For this reason, it's important not to take too much vitamin K2. So how much vitamin K2 should you be taking? Well, the answer depends on your individual situation. Someone who is just trying to meet their daily requirements can probably get this through diet alone. Someone who is deficient in vitamin K2 may need to take a supplement. But again, it's important not to take too much. Generally speaking, 100 to 200 micrograms per day is a good target for most people. Higher doses may be needed for someone who is actively deficient, but it's always best to check with your doctor before starting any new supplements. Before we end this video, let's briefly touch on vitamin D3, which is often talked about alongside vitamin K2. Vitamin D3 is actually the active form of vitamin D that our bodies make when exposed to sunlight. It's important for bone health, immune function, muscle strength, and reducing inflammation. Studies have also shown that vitamin D3 can reduce the risk of infection and help with autoimmune disorders. Unlike vitamin K2, vitamin D3 deficiency is much more common, particularly during the winter months when people aren't exposed to as much sunlight. Symptoms of vitamin D3 deficiency include bone pain, muscle weakness, and depression. But many people with vitamin D3 deficiency are actually asymptomatic or don't have any symptoms at all. This is why many doctors recommend that everyone get their vitamin D levels checked. So how do you know if you're low in vitamin D3? Well, the easiest way is to get a blood test. You can do this through a simple blood draw. The normal range for vitamin D3 is between 30 and 100 nanograms per milliliter. Anything below 30 is considered deficient. It's important to note that there is some controversy surrounding the normal vitamin D levels. Some experts believe that the normal level should actually be closer to 50 or even 100 nanograms per milliliter. If you're found to be low in vitamin D3, then supplementation may be beneficial. Unlike vitamin K2, vitamin D3 toxicity is much more common and occurs at much lower doses. Generally, doses above 10,000 IU per day for an adult are considered toxic. Children are much more susceptible to vitamin D toxicity, and even doses of 1,000 IU per day can be toxic. Thank you so much for watching. Stay healthy, stay safe.